Okay, take 4. Anatomy review. Before we begin auscultation of the lungs, we need to determine what part of the lungs we're listening to. So understanding the external landmarks that correlate with the lung anatomy is very important. Essentially, what this slide is saying is if we're listening on the outside, we need to know what landmarks or what external bony parts where we're at externally to make the correlation to where we're at internally. So what lung portion we're listening to, what lobe of which lung, and all of that. So basic lung anatomy is the right lung has 3 lobes. It has the right upper lobe, right middle lobe, and right lower lobe. They are separated by the horizontal and oblique fissure. So the horizontal fissure separates the right upper from the right middle lobe, and the oblique fissure separates the right middle lobe from the right lower lobe. The left lung has 2 lobes, the left upper lobe and the left lower lobe, and they're separated only by an oblique fissure. So we want to know what thoracic landmarks we're going to use to identify what lobes of the lungs. So here we have, I'm doing it again. I've said so many times. I apologize for this. My speaking is not as fluent as it should be. So we have the trachea here, and then we have our right main stem bronchus, and so we have our left main stem bronchus on the other side. The right main stem separates into 3 lobar bronchi. So we have the upper lobe, we have the middle lobe, and then we have the lower lobe. And throughout your Boise State RT career, you will hear go bronchi, and this is where that originates, and it's really funny. So you are part of the bronchi family, so go bronchi. It's the inside joke that you will hear very frequently. On the left side, we have our left main stem, and then it separates into 3 lobar bronchi, 2, and so it goes here, up and down. Super easy. Fissures, here's the horizontal fissure, and like we said, that separates your right upper from your right middle lobe, and then here's your oblique fissure, and that separates your middle lobe from your lower lobe. It looks like the right lower lobe is really small, but it's only because this right middle lobe comes anteriorly and the right lower lobe is posteriorly, so it kind of comes over the front of it. And we'll see on the next couple of slides that the right lower lobe is actually not as small as it looks from the anterior chest. It's just how much of it is viewed by the anterior chest. What is happening? There we go. I'm not sure what happened. I hovered over something and it went wrong. And so we can see where our diaphragm's down here below. We have our right middle lobe. We have our right lower lobe, our right middle lobe, and our right upper lobe. We have our left upper lobe and our left lower lobe. Again, this lobe of the lung looks really large so your left upper looks really large compared to your left lower, but this is because this is from an anterior to posterior view of the lungs, and so this majority of the left upper lobe is anterior. And we'll see in a minute that the majority of the bilateral lower lobes are posterior. This slide will be kind of your bread and butter of all that we need to know. This slide will be on a quiz next week. I can guarantee it because it's very important for us to know. So let's talk about the anterior chest first. The anterior chest is the front of the chest, and mid-clavicular. So mid-clavicle, front of your chest. So you can put your hands on your clavicles on the front of your chest and think about mid-clavicular. So above the clavicle are the apices of the lungs. So right in the middle, you have a little bit of both of your upper lobes, your right and left upper lobe, a little bit above your clavicle. So that's good to know. So they're called the apices, or the tops. So the tops of the lungs. So the little bit above both clavicles are the apices of your lungs. Between your second and third intercostal space are your right upper and your left upper lobes. So when you're down 2 intercostal spaces, so you can go down here to your sternum and count your intercostal spaces where they go on 2. So between your second and third intercostal spaces, you're still in the both upper lobes of your lungs. And I have diagrams, so this is going to make more sense in just a minute. Once you get to the 4th intercostal space, and between the 4th and the 5th intercostal space is generally where the nipple area is, And so we're going to use that as a landmark in a lot of cases to know where we separate from that right middle lobe and that right upper lobe. And we're still in the fourth intercostal space on the other side on the left upper lobe, and that'll make sense in a minute. After the sixth intercostal space, we're in our right lower lobe and left lower lobe, but that's also mid-axillary. So in your armpit, you can hear more of the lower lobes, and that'll make sense in a minute too. So anteriorly, between the second and the third intercostal space, you're still in your upper lobes. Once you get to your fourth intercostal space, so your fourth to your sixth, you're in your right middle lobe, still in your left upper lobe. After the sixth intercostal space, mid-axillary, so meaning in your armpit when you're auscultating, you will be in your right lower lobe and your left lower lobe. So from the front, these are your landmarks for what you're listening to. Posterior chest, so the back of the chest, primarily we're listening to the lower lobes, and that'll make sense in a minute. So, above T7 are your upper lobes, T7 to T11 are both the lower lobes. Here is another little diagram talking about, so they're calling the superior the upper. So you have your right upper lobe, right middle lobe, right lower lobe, left upper lobe, and left lower lobe, separated by the horizontal fissure between the upper and middle, and then the oblique fissure between the middle and the inferior or lower. And then on the left side, you just have your oblique fissure separating your left upper lobe and your left lower lobe. This little slide, which, sorry about that, which I need to kind of get it to be a little less blurry. I need to sharpen this up a bit before tomorrow. You can kind of see this is a good depiction of what you're hearing where in reference to the anterior chest and the posterior chest. Right upper lobe, and if you counted down, you would probably be about right here for your nipple. So you can think about where your armpit is, comes over, your armpit starts and comes over about where your nipple is. And you know that that's about where you separate your right middle from your right upper lobe. So we're probably about the fourth to fifth intercostal space right here. And below that is your right middle lobe. And then you can see how much of this right side that you can actually auscultate anteriorly. And that's why they say mid-axillary, you can hear more of your right lower lobe than anteriorly, because you can see that there's not a big portion of that you can auscultate from the front of the chest. Primarily right upper lobe till about the nipple line. Then we're in our right middle lobe. And if we want to auscultate the right lower lobe from the front, there's a very small portion of it that we can auscultate anteriorly. So generally mid-axillary and posteriorly are when we're going to hear our lower lobes best. Also the case for the left side. So your left, you can see how much of your left upper lobe is auscultated anteriorly or lays anteriorly, so we can hear it. Again, mid-axillary, below the sixth intercostal space is where you're going to hear your left lower lobe. So not a lot of auscultation of the right lower lobe or the left lower lobe from the anterior chest. And no, about just below the nipple line is where we're going to transition from that right upper lobe to our right middle lobe. I hope that makes sense. Posteriorly, you can see how much of that. So it says from on our slide a couple slides ago, it says T7. So we got I think C7 is about here. So we have 1, 2, 3, 4, 5. I must have counted those wrong. 1, 2, 3, 4, 5, 6. So 6-ish to 7-ish, they're showing us on here of our thoracic vertebrae is where we transition from so these are our upper lobes and these are our lower lobes, okay? So you can see that bilaterally on each side, so you don't even auscultate your right middle lobe from the posterior. You don't see that, or you don't hear it from there. So primarily from the posterior, we are listening to the lower lobes. So here's mid-axillary on our right side. So you think about under your right armpit, how much of this is lower lobe that you can hear here. So that's why they say if you want to auscultate your lower lobes, you either do it from the posterior chest or from the mid-axillary, because you can see you can access your middle lobe, upper lobe, and lower lobe mid-axillary. On the left side, your upper lobe and lower lobe. So you can see where that comes so much more anterior than your lower lobe. Okay, hope that makes sense. Here's just another little diagram kind of on a person, and that gives us a good idea, like we're talking about with that nipple line as our indicator. So you can see right here at his nipple is about where it transitions into from his right upper lobe to his right middle lobe, and then the lower lobe over here. So you can see where you can auscultate that lower lobe mid-axillary. A little bit of the middle lobe, the upper lobe's really pretty hard to auscultate through the mid-axillary section because of how far up the armpit you want to go. And so the same over here, the oblique fissure comes down there too, so that gives you a good idea of where you can auscultate the lower lobes if you want to hear them. And it also shows you, it's a good depiction of how much of your ribs do not have lung under them. So your diaphragm comes up underneath here, and your lungs will actually expand as you inhale, and so that makes sense, right? You're breathing in more air, so your lungs expand. So they'll go down a little bit and up. So just some landmark stuff. This is kind of my favorite slide. It shows you anteriorly again, your right upper, right middle, and your right lower lobe, kind of where to auscultate them, where they're at in reference to your sternum, where they're at in reference to your clavicles, and where they're at in reference to your intercostal spaces. So here's 1, 2, 3, 4. So like we talked about, between 4 and 6 is your middle lobe, and then after 6 is your lower. And over here, this is interesting because that's about where your oblique fissure comes down on your left side too. It starts at about the nipple line. So you know that the majority of what you're listening to on that left side is anteriorly is your left upper lobe, and then where your left lower lobe is. Posteriorly, the same in the back. Count down your spinal processes, but you can kind of just even go like halfway down the scapula is about where the fissures are. So this is an interesting view of how the lungs lay under the scapula. So you think about thoracic landmarks and bony structure that you can help identify with. You can think about halfway down the scapula is about where you transition from upper lobe to middle lobe. So there's another little bit. If you don't want to count down to T7, you can just kind of know about halfway across the scapula is where it comes down, but then keep in mind how it goes down. It follows the rib, okay? This is another little depiction, so you can see here between 4 and 5 is where your nipple is, and that's about where that separation is right there between your right upper and your right middle lobe. And this is showing the diaphragm borders. So this is a really good drawing once we get a little more in depth with the anatomy, and you guys know all this. So it shows the heart, where the heart sits in here, and then it shows the diaphragm border. So as your diaphragm contracts, and so as it flattens and and goes, as it flattens and goes up like it does when you breathe in, how your lungs expand and come down. But generally when you're auscultating, where the reference for those things is. Another little reference from the front, and so we can see the apices just a touch above the clavicles, so keep that in mind when you're auscultating in the front, about where that divider is for your middle lobe and where your lower lobe is on both sides. Okay, so if you're thinking about auscultating and the anatomy underneath there, we think from the anterior side on the left side. So in the front on the left, we're primarily listening to left upper lobe. Down here, we do have lower lobe, but it's easier to access and listen to posteriorly or mid-axillary. Same over here. The right middle lobe is under the nipple. You can kind of think of it that way. And then the right lower lobe, mid-axillary. Not a lot of that can be auscultated anteriorly. Here is a good little diagram of where to listen because of how the bony structure falls. So we know between the sternum and mid-clavicular is about where we want to listen. So these are going to be our auscultation sites, and we have an entire slide dedicated to that. Mid-axillary, we know here's our nipple. We know that the transition from here, we've got mostly on this front side, we have right middle lobe, and on this side over here, we have right lower lobe. So that's a good way for us to know where to listen mid-axillary. There's a lot of lung posterior and a lot of the posterior lung that we can hear, a lot of the lower lobes of the lungs that we can hear mid-axillary. I said that wrong. And then on the back, you can see here, and we talked about the scapula, how about midway through it, that's about where the separation between the upper and the lower lobes are. But when you're auscultating, you don't want to auscultate over the big bony structure of the scapula. You want to make sure and go between the middle of the vertebrae and the scapula. So these are going to be our auscultation sites for posterior listening. Excuse me. So more anatomy, more where we're at, kind of, and then a break.